Okay guys, let's start with the first topic of lower limb, that is the gluteal region. And okay, the main one is the gluteus maximus and the structures under it, and the other one is gluteus medius and it's applied. Third one is the sacral plexus and short lateral rotators of hip and the Trendelenburg sign. These are the important questions in the gluteal region. Okay, now let's move on to the muscles of the gluteal region. They are divided into three layers: the superficial layer, the middle layer, and the deep layer. The superficial layer has the gluteus maximus and tensor fascia lata. The middle layer has the gluteus medius, piriformis, superior gemelli, obturator internus, and inferior gemellus, and quadratus femoris. And now the deep layer, it only has gluteus minimus. And now for an easy diagram to depict the gluteal region. First you draw the gluteus maximus, the largest structure. And then you go to the middle layer, the tensor fascia lata, the gluteus medius, the piriformis, superior gemelli, inferior gemelli, and obturator internus. And then the quadratus femoris, and then to the deep layer, the gluteus minimus. And then you draw the inferior gluteal nerve and then the superior gluteal nerve. And okay, now moving on to the gluteal region proper, gluteus maximus. It is the largest and most superficial structure in the gluteal region. The origin is from four sides: the dorsal segment of iliac crest, the dorsal surface of iliac bone, dorsal surface of the sacrum bone and coccyx bone, and the sacrotuberous ligament. And now on to the incision in two sides. The major part, that is a 3/4, will be inserting into the iliotibial tract, and a small part into the gluteal tuberosity of femur. And then on to the nerve supply. Nerve supply is by the inferior gluteal nerve. Actions are chief extensors of the hip joint. It also helps in the lateral rotation of hip. Now to another important 5 mark, the structures undercover the gluteus maximus. Muscles are gluteus medius, piriformis, superior gemelli, inferior gemelli, obturator internus, quadratus femoris, and gluteus minimus. Vessels and nerves will be inferior gluteal nerve and vessels, pudendal nerve, inferior pudendal vessels, nerve to obturator internus, sciatic nerve, and the posterior cutaneous nerve of thigh. And now moving on to the bones, they will be the ischial spine, ischial tuberosity, and the greater tubercle of femur. And now to the ligament, they are sacrospinous ligament, sacrotuberous ligament, and now we move on to gluteus medius. The origin is the gluteal surface of ilium bone. Insertion will be into the lateral surface of femur of greater tubercle. And then to action, it will be the abduction of hip joint and the medial rotation of hip joint. Applied is all injections are given in the gluteus medius lesion. Now on to the applied, that is Trendelenburg side. Normally gluteus medius and minimus of one side prevent the sagging of the opposite side. In superior gluteal nerve injury, paralysis of gluteus medius and gluteus minimus muscles of same side occurs. In this, sagging of the pelvis on the opposite side, that is a healthy side, occurs. This is known as Trendelenburg's positive sign. It causes lurching gait, which affects the gluteus medius mainly. It's easy anatomy for you. If you like the video, please like and subscribe to the channel. Thank you.